Good afternoon. I'm Reem Ali, Vice President at the Health Policy Institute of Ohio. Thank you for joining us for the Home Visiting in Ohio Capacity and Readiness Assessment webinar. I hope you are all healthy and doing well and adjusting as best as possible to this new reality. Before we get started, I do have just a few housekeeping items to go over. For now, everyone is in listen-only mode. We do want this to be an interactive meeting, so if you have a question, please type it into the question box. There will also be opportunities for discussion later in the webinar. During the discussion, raise your hand and we will unmute you. Keep in mind that if you have muted yourself, you'll need to unmute your audio. To participate, please make sure that you have entered your audio PIN. You do need to log into the webinar first before calling to get that audio PIN. You can find the agenda and slides, as well as a recording of today's webinar posted on HPIO's MCH McV Groups page. The recording will be available after the webinar. You can find this by going to hpio.net and clicking on Groups. We've also made the slides and agenda available under handouts, which you should see as one of the tabs that you can click on in your webinar. HPIO was contracted by the Ohio Department of Health to facilitate development of the state's maternal, infant, and early childhood home visiting assessment, or MCV, as you'll hear it be called throughout this webinar. As part of this process, we are gathering data and information on Ohio's home visiting landscape with a specific focus on the capacity and readiness of home visiting providers in the state. Here you see the agenda for our meeting today. You can also download the agenda under the handouts for this webinar, as I mentioned just a bit ago. And here are the objectives for today's meeting. We'll provide an overview of the requirements of the McV Needs Assessment and talk about the purpose of the online survey so many of you responded to just a few weeks ago. We'll also be reviewing and getting additional feedback from all of you on the preliminary key findings from that online survey. We want to thank you all who took the survey very much. That information you provided is going to be critical to get a pulse on the issues that you are facing as home visitors from across the state. And with that, I will hand it over to Alicia Leatherman, who oversees the early childhood home visiting and maternal and infant wellness programs at the Ohio Department of Health, to provide more background and context on this work.
Thanks, Reem. And I just want to say thank you to our colleagues at HPIO for hosting the webinars and for their adaptability. As most of you who are on this call likely know, we intended to have in-person regional conversations, and well, the public health system and our environment had different plans for us. So being able to still have collected information from all of the home visiting programs in Ohio and to be able to have this conversation virtually is great, and we appreciate the ability to do so through HPIO. Next slide. So I just wanted to provide a little bit of context before Becky and Reem get into the specifics around the responses. So while we do call this the McV Needs Assessment, I just want to explain that it is intended to be a broader look at Ohio's home visiting system, that which is funded by the federal government, that which is funded by our state, that's administered through a variety of agencies, both at the state and local level. We refer to it as McV because as a condition of the Ohio Department of Health receiving dollars to support home visiting, we have to complete a needs assessment every 5 years. And so the funding for this needs assessment comes out of our federal funding, and it is required in order for us to be compliant with those resources. So we call it McV, but it is not intended to only inform what the Ohio Department of Health does with our funding, it's really intended to support the planning and implementation of home visiting across the state and at the local level. So we hope that when this is done, that this tool really provides local communities, regional partnerships, and our state colleagues, our agency colleagues at other state agencies with a tool that they can use to have conversations about what's needed to take home visiting, to expand home visiting, but also to improve what's happening in our home visiting system in Ohio. Next slide. As Reem mentioned, the survey, and we'll get into the responses, but I just want to say a big thank you for people taking the time to complete the survey. It was up for a short period of time, which maybe is a strategy we'll use moving forward because it seemed to work. Either the topic or the timing worked well. So we really appreciate everyone taking the time to complete the survey. I also want to mention a little bit about who completed the information. And again, my colleagues at HPIO will get into much more detail about this in their presentation. But it was extended to a broad group of people. And today on this call, we also have a broad group of people that are participating in the call. So just to clarify, it includes the Ohio Department of Health funded models and programs, the Ohio Department of Medicaid funded projects, projects that may be funded from the Ohio Children's Trust Fund, the Community Pathway Hubs, our colleagues and partners at the Early Head Start Association and in the Early Head Start community were also encouraged to participate. Spark, the Healthy Start grantees that are located in 5 communities in the state, and then any locally funded program that we were aware of. We wanted to make sure that we included additional partners at the local level as well. So the questions, the comments will vary based on your different experience and model, and we really appreciate that diversity in the results. So I'm going to turn it over now, I think, to Reem or to Becky, I'm not sure which, I apologize, to walk through the survey results.
Thank you, Alicia. This is Reem again. Before we get into the survey results that I know you guys are waiting to hear, I just wanted to provide a bit more background and overview on the McVie Needs Assessment update. Under federal law, Ohio is required to conduct a McVie Needs Assessment update by October of 2020. The purpose of this needs assessment is to gather updated information on community needs related to early childhood home visitation, as Alicia mentioned, and to help ensure that McVie programs are implemented and funding is allocated to areas of high need. There are 4 primary components to this needs assessment that you can see here on your screen. The first is using data provided by the Federal Health Resources and Services Administration to identify communities with concentrated risk or the greatest need for home visiting services. Another component of this needs assessment is assessing the quality and capacity of early childhood home visiting services, including gaps in early childhood home visitation and the extent to which programs are meeting the needs of eligible families. Assessing the state's capacity to provide substance use disorder treatment and counseling services to pregnant women and parents with young children is the third component. And then finally, identifying opportunities for state agency collaboration and coordination to meet federal requirements. HPIO has been working closely under contract with the Department of Health over the past year to gather this data and information that informs all 4 of these needs assessment components. Through the first half of this year, we have been focused on gathering additional information and updated data to assess the quality and capacity of early childhood home visiting services. As you'll hear from my colleague, Becky Carroll, in just a minute, a primary purpose of the online survey you responded to a few weeks ago was to help gather this additional information with a specific focus on the areas you see here. Again, these are the federal submission timelines for the McPhee Needs Assessment, and the final needs assessment will be submitted to the federal government by October 1st of this year. And at that time, we know that the Department of Health will be making that needs assessment available and posted for all of you to review. And with that, I'll turn it over to Becky Carroll from HPIO to talk more about the purpose and process for the online survey. It always takes us just a little minute to transition, but hopefully you'll be able to hear Becky soon. As Becky goes through her slides, and she's going to be talking about the preliminary findings in just a bit as well, please be thinking about any questions that you might have. We will have opportunities for discussion and for questions. So please be thinking about that as well as we share the preliminary findings.
Hello.
We can hear you, Becky.
Great. Okay. Sorry about that. Just some technical difficulties, as Ree mentioned. My name is Becky Carroll. I am a policy analyst at HPIO. I'm going to be giving you some quick background on the survey, and then we'll dive into the findings. As Ree mentioned, the McVie Needs Assessment Update requires states to analyze the capacity of existing early childhood home visiting programs. As part of this, states are encouraged to assess community readiness through considering gaps in staffing, community resources and support, and other requirements for implementing evidence-based home visiting services and demonstrating improvements for eligible families. As Alicia mentioned earlier, due to COVID-19, the Ohio Department of Health chose to administer an online survey in place of regional meetings to collect this information from home visiting providers. The Ohio Home Visiting Provider Capacity and Readiness Assessment Survey was open for about a week and a half. It consisted of 23 questions. I want to mention that you may not have been asked to respond to all 23 questions. Based on your responses to some questions, the survey may have had you skip a follow-up question asking for more details. So some questions we go over today may not look familiar. There were a total of 99 survey responses, which is wonderful. Since we limited it to one response per organization, we know that in many cases, these responses were an organization-wide effort, not just an individual effort. So we really want to thank everyone who contributed to these survey responses. We had a total of 81 counties represented by at least one survey respondent. We had very good representation across all county types. And here is a map of which counties fall within each county type. We also had great representation across home visiting regions. Here you will see the 6 new home visiting regions that were introduced by the Ohio Department of Health earlier this year, which will officially become effective in July. We were also pleased to see a large variety of home visiting models and programs represented. The ones denoted with an asterisk are evidence-based home visiting models based on the Department of Health and Human Services Home Visiting Evidence of Effectiveness List, or Home V List, which is used by the McPhee program. And in case some of you are unfamiliar with these a few acronyms we have here. SPARK stands for Supporting Partnerships to Assure Ready Kids, and HIPPY stands for Home Instruction for Parents of Preschool Youngsters. Both aim to improve school readiness. Now we're going to go through some preliminary key findings from the online survey related to capacity and staffing. The first question asked about the largest barriers impacting your ability to serve all pregnant women and families eligible for and requesting home visiting services. Here are the top 10 responses out of a total of 18 choices that included some others added in by survey respondents. The most commonly selected were challenges related to retention and initial engagement of families. Next was a lack of adequate funding. The fourth most common was about the eligibility restrictions of specific home visiting models or programs. And the fifth most common response was related to hiring challenges. And we'll dig a little deeper into that one in just a few minutes. We looked at how the top 3 barriers selected varied across county types. You'll notice that there are 4 barriers shown for Appalachian counties because there was a tie for the number 3 spot. There was no barrier that was identified in the top 3 across all county types, but there were several that showed up in 3 of the 4. Initial engagement, as well as referral challenges, showed up in the top 3 for all county types except for urban. Interestingly, 2 of the top challenges identified by urban counties did not show up in the top 3 for any other county types. These were funding and administrative burdens. The only other challenge that was unique to a county type was hiring challenges, which was in the top 3 for Appalachian counties only. And again, here's that map of county types. Here are the top 3 barriers selected by different home visiting models and programs. Safe Care Augmented, HIPPY, and the Healthy Start sites are not shown because they had very low response numbers. Interestingly, you'll notice that there was no barrier that appeared in the top 3 for all of these models and programs. Retention appeared in 5 of the 7 for all except Early Head Start and Pathways Community Hubs. Inadequate funding appeared in 4 of the 7. Lots of the same challenges, however, popped up among the Home V models, which is the table on the left. Retention appeared in all Home V models except Early Head Start. Inadequate funding was in the top 4 for Healthy Families America and Nurse Family Partnership, while initial engagement and challenges related to referrals appeared in the top 3 for both Parents as Teachers and Early Head Start. The only top 3 challenge unique to a Home V model was hiring challenges, which was selected by Nurse Family Partnership programs. There was not quite as much consistency among the top 3 challenges identified by the programs in the box on the right, and there were more challenges that were unique to a single program. For example, Moms and Babies First programs identified Ohio Department of Health eligibility restrictions and staff turnover and retention as top 3 challenges. Hubs called out data reporting and hiring challenges, and Spark programs identified initial engagement as their top challenge. Next, we asked all home visiting respondents how often their home visiting program has a wait list. Half of programs reported never or rarely having a wait list. 21% said sometimes, and when added together, there was a total of 28.6% that said either very often or always. We broke the data down and looked at the percentage of programs in each home visiting region that reported very often or always having a wait list. The lowest percentage was in Region 3 at 17.7% of programs, and the highest was in Region 5 at 42% of programs. We also looked across home visiting models and programs. The model with the highest percentage of programs reporting a waitlist very often or always was nurse-family partnership. And on the flip side, you'll see that none of our respondents representing Moms and Babies First programs or Pathways Community Hubs reported very often or always having a waitlist. Again, HIPPY, Safe Care Augmented, and Healthy Start are not shown due to small response numbers. The survey also asked if you are able to serve all pregnant women or families that are eligible for and wanting home visiting services through your program. Over 80% of programs reported that they are always or very often able. 15% said sometimes, and a total of only 3% said rarely or never. Those programs who responded that they were sometimes, rarely, or never able to serve all pregnant women or families eligible for and requesting home visiting services were then asked, what are the most important things that would be needed or what would need to happen in order to increase your program's capacity? By far, the most common response was related to a need for additional funding or support to hire additional home visiting staff. The first survey question related to staffing asked programs if they have trouble finding and hiring qualified staff for home visiting positions. A total of 27.3% of programs said they usually or always have trouble, and another 40% said that they have trouble sometimes. All of these programs that sometimes, usually, or always have trouble hiring were then asked to identify the top 3 reasons why they believe they have trouble finding and hiring staff for home visiting positions. By far, the 2 most common reasons selected were compensation is too low to attract desirable candidates, and candidates lack required experience or degrees. The next most common responses were that candidates lacked the necessary knowledge and skills, and barriers associated with training, which include such challenges as the availability and costs of trainings and the costs associated with hiring staff and not being able to get them trained right away. When we look at the top reasons for hiring trouble across regions, we see quite a bit of consistency. The top 3 reasons that showed up for the state overall were also in the top 3 for all regions except Region 5, for which barriers associated with training was the 3rd most commonly selected reason. A smaller percentage of programs reported challenges with staff turnover and retention. Only about 12.4% of programs reported very often or always experiencing trouble with staff turnover and retention. 35% said sometimes, and over 52% of programs said they rarely or never experience such challenges. Those programs who reported that they sometimes, very often, or always experience challenges with staff turnover were asked to explain why. By far, you'll see that the most common reason given was compensation. Stress and burnout were also commonly mentioned. Other responses in the top 5 were administrative burdens, career or professional advancement, and competing family or personal priorities. In this category, programs often talked about the challenge of working inconvenient hours in these home visiting positions. I'm going to pause here to see if anyone has any questions, and then we'd like to get feedback on the preliminary findings I just reviewed. As a reminder, if you would like to speak, please raise your virtual hand and we will unmute you. Keep in mind, if you've muted yourself, you'll need to unmute your audio. If you would like to speak, please also make sure that you have entered your audio PIN. You need to log into the webinar first before calling in order to get your PIN, or you're always welcome to type your questions into the question box as well. So we will give folks a couple minutes. Sorry, Reem, do we have any questions yet?
We do. We do have one question, and it's from Justin. And Justin, I might ask you to unmute yourself and raise your virtual hand and unmute yourself if you have muted yourself to give a little bit more context around this. And the question is, for programs that have wait lists, was consideration given to programs who are newly created and ramping up, or to those who experienced growth and therefore greater capacity? So Justin, are you asking this in response to why a program might have a wait list over
No,
another
he does have
program?
his hand raised, so I'm going to unmute him.
Great.
Justin?
Good afternoon. So yes, I was just asking for kind of clarity on that. Some of the programs that indicated no wait list either were new to our state in the last year and are ramping up capacity currently, or like as funding pictures evolve, they may have different capacity challenges. So I just wanted to make sure that that consideration was being considered as well.
That is a great point, Justin. And no, we hadn't really thought about that, but that is definitely something that we will keep in mind.
Can I just respond a little bit? This is Alicia.
Of course.
Justin, thanks for your question. I think the challenge that we have with when we try to assess growth and some of what agencies are experiencing is sometimes it's people's intent to grow or desire, but when we look at kind of what is a timeline, how do we make that a little bit more realistic or actionable for our planning purposes? Because sometimes agencies may intend to do it, but we don't actually see a change in capacity for 6, 9, or 12 months. So I think, us trying to think about how we think about what growth looks like and how we match the intent that people have with what we're actually seeing needs to be lined up as well.
Thanks, Alicia. Reem, do we have any other questions?
We just have one question about whether or not the webinar is being recorded. It is and will be posted to that HPIO MCH McV groups page after the webinar today. We
I
don't
see
have
one more
any.
hand.
Oh, great.
Donna, I'm going to unmute you if you still have a question.
Donna, are
do
you there?
still have a question? All right, I think we can move on.
Okay. Well, if Donna, we're going to have another opportunity for questions near the end of the webinar. If you think of, or if you would like to try to raise your hand again, or if anyone else thinks of anything between now and then. Just 1 minute here. We'll get the discussion questions pulled up. We are going to move on now to the discussion questions, which are shown here. First, we would love to hear what you found most notable about these findings. And our second question is, what, if anything, was not captured in these survey findings related to capacity and staffing that you feel is important to highlight? And we already had a comment on this from Justin, but we'll take feedback on both of these questions right now. Again, we would love to hear from you, so please raise your virtual hand if you'd like to speak, or type your comments into the question box.
Thanks, Becky. And just as a reminder to folks, if we know that this was a lot of information to take in, so if it's helpful, The slides are available, both they're already posted on the HPIO group's webpage under MCH and McV, so you can go there to access the slides if you'd like to reference back to one of the data points that Becky has already gone over, or you can pull it up under handouts under your handout taskbar in this webinar. We have another comment, and I was intrigued by how HPIO took into consideration the types of counties and the great population diversity across our state. I think that shows that some of the needs and barriers are stratified differently across our state. Thank you for that comment. And yes, certainly there's going to be differences by geography in how and what folks are experiencing in their provision of home visiting services. Another question for you, Becky. I noticed that the data is separated by models. For sites that have multiple models, how was that data separated out?
We did an analysis by the different models, so those should have been reflected in the data that was shown. Reem, do you want to add anything to that to clarify?
Sure. So one of the questions was what models do you operate, and so that question was then used to stratify the responses. So if you were operating more than one model, your response may have been attributed to more than one model. We unfortunately didn't have a way to parse it down further, but if you feel like there were things reflected in the preliminary key findings that or not reflected that you would like us to highlight, this is a great opportunity to point those out.
Okay, do we have any other hands raised or questions at this point? All right, well, I think that we will transition to Reem. Thank you so much for all of you that provided comments and questions. I'm going to turn it back over to Reem, who will go over the rest of our survey findings.
Thank you, Becky. Again, we know that there's a lot of information that we're covering on this webinar, and so if it's helpful that the slides are there for you to reference. Again, please feel free to be typing questions into the question box, either over what I'm going to present or what Becky has already presented, and there'll be another opportunity for discussion as well. I'm going to be reviewing the preliminary findings related to community resources and supports, as well as recommendations for improving home visiting in the state. When asked whether there were adequate health and social services and family supports available and accessible to pregnant women and families with young children in need of those services, nearly half of respondents said yes, while the other half responded either somewhat or no. We asked those who responded somewhat or no to identify where the most notable gaps in services and supports were, and here you see the top 10 responses. 50% or more of respondents identified that the most notable gaps were around childcare, housing assistance, and diaper banks. And notably, both parental and pediatric mental health treatment and services and supports were among top 5 responses. We also took a look at top 3 responses to this question by the 6 home visiting regions. And we did see some variation in response. More than 3 responses are listed under a region in the event of ties, and red indicates a response that was unique to a home visiting region. Otherwise, the common responses are all highlighted in the same color. Again, housing assistance, childcare, and diaper banks were the most common response across regions. They were identified in 4 or more of the home visiting regions. Pediatric primary care and specialty care services were identified as a unique top 3 gap in Region 1. Utilities and car seats were identified as unique top 3 gaps in Region 3. And then additional baby supply assistance was a unique top 3 gap in Region 5. I'll give you a second to just take a look at this slide. In the survey, we asked questions to identify the extent of collaboration both among home visiting programs and between home visiting programs and early childhood education programs. Here you see responses describing the extent of collaboration among home visiting programs in a county. Notably, about a quarter of respondents indicated that home visiting programs in their county made or shared referrals and or provided transition support to one another, and also that there was strong collaboration and coordination in their county. Other top responses included having regular communication and meetings and sharing services, trainings, resources, and or space. Nearly 15% of respondents did indicate that there was a lack of collaboration or coordination in their county. Top responses by home visiting region were very similar. However, competitiveness was identified as a top 3 response in home visiting region 3, which is in the southwest part of the state, and also in home visiting region 4, which is in the northeast part of the state. Here, you see responses describing the extent of collaboration among home visiting programs and other early childhood programs in a county. Again, making or sharing referrals and transition support was a top response. Nearly 30% of respondents indicated strong collaboration in their county, while about 20% indicated a lack of collaboration. Collaboration in the form of participation in a joint committee, council, or other initiative, and sharing services were again among the top 5 responses. For this question, there really were no notable differences in top responses by home visiting region. Survey respondents were also asked to assess whether there is an understanding and appreciation of home visiting in their county. More than 86% of respondents said that there was either some or widespread understanding and appreciation of home visiting, while 14% said there was very little understanding and appreciation. Of those who said there was very little understanding and appreciation of home visiting in their county, confusion and lack of understanding about what home visiting is were the primary reasons cited for why it appeared like there was not buy-in or support. Online survey participants were asked how state agencies could work more effectively and efficiently together to support home visiting in the state. Top responses here included promoting common goals between home visiting programs and partners, increasing automatic referrals to home visiting from Child Protective Services, WIC, and Medicaid, increasing public education and awareness of home visiting, increased funding support, promotion of a unified home visiting approach, which includes common definitions, as well as increasing coordination of state-level meetings and communication across state agency and other local level partners. As many of you know, the governor convened an advisory committee on home visitation early last year and charged the committee with developing recommendations for achieving his goal of tripling the number of Ohio families served through evidence-based home visiting. This report that was produced includes 20 recommendations to expand and enhance the quality of home visiting services in the state. We asked survey respondents to identify which of the governor's recommendations were most important and should be prioritized. Here again, you see the top 10 responses, with expanding and streamlining eligibility requirements to increase the number of at-risk families that can be served as the top response. I'll give you a few seconds to review this list. When asked why they prioritized the recommendations they had selected, respondents' number one reason was to expand the number of families being served, followed by increasing funding support for staff supervision, training, and retention, and increasing collaboration with and referrals from Child Protective Services. Promoting equity and culturally competent home visiting services, as well as increasing public education and awareness of home visiting, were also among the top 5 responses. Finally, we gave online survey participants the opportunity to comment on anything else they would like to discuss regarding their program's capacity to provide home visiting services to pregnant women and families in need. Many of the comments reinforced responses that we heard to other questions. The most common responses were concerns or suggestions related to family recruitment, referrals, or engagement, followed by comments regarding the need for additional funding or support, and requests for increased recognition of specific home visiting models. Many respondents also emphasized that either they could or wanted to increase capacity, which is something that Alicia referred to a little bit ago. And finally, the fifth most common type of response was related to concerns about central intake and data access. For instance, there were several survey respondents who mentioned that they do not receive any information about the families on their waitlists and described how this information would be helpful to have in terms of making sure that they were serving those with the greatest need. And that wraps up the preliminary key findings from the online survey. I'll pause just to see if you have any questions, and then we'd like to get feedback on those preliminary findings that we reviewed. A reminder, if you would like to speak, please raise your virtual hand and we will unmute you. Or, of course, you can type your questions into the question box. And we're happy to take questions or comments about anything that you have heard so far in the presentation. So here you see the discussion questions. Again, we'd love to hear from you on what you found to be most notable about these findings and what, if anything, was not captured in the survey findings that you feel is important to highlight, particularly if it's specific to a program or home visiting model that you feel like maybe was not adequately captured in the survey findings. We would really appreciate some more insight into that. And in addition, we'd like to hear from you around what else we should consider in interpreting the survey findings and updating the McV needs assessment. So I will just
Okay,
give
Reem,
folks.
we have a comment.
Okay, great.
Justin says it's interesting to see well-known or not well-known home visiting programs and services based on provider experiences. Yes, thank you for that comment, Justin. We definitely have been interested to see the difference in these questions as we've broken it out by model and program. Anyone else has a question? Why don't we check in with Alana and see if anyone has a hand raised?
Not just yet, but we'd love to hear from you.
Okay, well, we just want to remind you, we know that this is a lot of information to absorb, so remember that you can pull up a copy of the slides under handouts on your webinar dashboard menu if there's anything you want to check again.
And Becky, I do have a hand now.
Okay, Go ahead.
It looks like Margaret has her hand up. I'm going to unmute you, Margaret. Go ahead and ask your question.
Yes, this is Margaret from Every Child Succeeds. This is a small thing in some ways, but in other ways not. On one of the slides, collaboration among pediatric sites and birth hospitals, and it was rated pretty highly too, but it wasn't highlighted. I don't know if it's just because you were only picking a certain number, but I don't want that to get lost in the discussion.
Thank you, Margaret.
Absolutely.
Go
Thank
ahead,
you,
Reem.
Margaret. I was just going to say, yeah, we definitely will make sure that that is highlighted just for the purposes of discussing with all of you. We did just select the top three or three, four, or five to talk with you, but certainly the ones that you saw on that graphic will be highlighted in the needs assessment as well. If you have additional context that you think is important for us to keep in mind in interpreting that result, we would be happy to hear that. I see that there's another question regarding what next steps are. Becky, so if you want to respond to that.
Sure. Well, what we do know is that the McVie Needs Assessment update is due to the federal government in October, as Reem had mentioned earlier, and that the Ohio Department of Health does plan to post that final needs assessment on their website later this year. Alicia, I want to give you an opportunity to add. Would you like to add anything at this point?
Just that in addition to posting it on our website, we likely will distribute it broadly, offer opportunities for people to give us some feedback. But we will be sharing and using this document with our partners, our state agency partners, our local partners, as we think about improvements. We are all charged by the Governor's Office of Children's Initiatives to make the recommendations that were submitted to the governor, to take a look at those and to utilize those. So part of what we'll be doing as well is looking at these survey results in conjunction with those recommendations to really prioritize what can and should be worked on next for the home visiting system. And that's within that which ODH oversees and manages, and again, sharing it with our colleagues and other state agencies as well.
Thank you, Alicia. We do have another question, and is waitlist noting that it includes families with children over 3 months due to model criteria, and that's from Jolene. So Jolene, if you're able to use your audio and speak just to give us a little bit more clarification on that question, that would be great. While maybe you're doing that, we'll see if you can raise your hand so we can unmute you. I'm just going to speak to that question on the online survey. So the online survey asked home visiting providers if they had a wait list and kind of tiered it. So very often or rarely, and tiered it by different levels, as you saw in the slides that Becky presented. And so that was all encompassing. It meant, at any point, does that provider experience having wait lists with families? It wasn't specific to a particular model or program. So I am sure that what that wait list looks like is going to vary depending on the model and program. Jolene, I'm sorry you don't have a microphone, but did I answer your question? If you want to just let me know, you can type that into the question box.
And Reem, can I just add a little bit? This is Alicia.
Absolutely.
We also, for the McVie, the needs assessment, in addition to the survey results, are also trying to utilize the information that we have available through central intake and referral on wait lists to also provide some context. So to Jolene's question, it would include families that are not able to be served in a community if there's only one model, but our partners at Central Intake do try their best, even if it's not programs in OKids when there is a waitlist situation, to also try to find alternative programs or partners to refer that family to who may be able to serve them more quickly. But that will be taken into consideration. And can I also add a follow-up to the next step question? I also think that some of the questions and some of the feedback that we're getting also we'll be able to, from an ODH standpoint, to respond and to put tools in place. One of the examples that Becky and Reem provided is around some of the specific comments in this last section, like people being able to see their wait list. We do know that it's probably just part of what our practice needs to be to do OKIDS update webinar opportunities for people so that the new functionality as it rolls out, or that we're ensuring that people have that latest information. So sometimes there are tools that are available that that are missed, and functionality that's missed, and we want to make sure. So that's an example of a next step that we're likely, because of some of this feedback, going to just offer some opportunities for people to get updates about OKIDS and reporting on a regular basis in the event that there are new supervisors, new staff, new people in their agency who could benefit on getting either the information for the first time or getting a refresher. So we'll also use this information to help guide some of the training and technical assistance that we provide to the existing Ohio Department of Health provider network.
Thank you, Alicia. Oh, do we have another?
There's no other questions in the question box right now. Alana, do we have any hands raised?
Not yet, but don't be shy.
All right, we just want to make sure that we give everybody an opportunity to ask a question if they'd like to, or feel free to put a question into the question box, either for any of the findings that we've gone over, or again, to ask Alicia any questions that you might have. All right, I don't see any additional questions in the question box, and I don't believe there are any hands raised. Are there any hands raised, Alana?
We're all good.
All right.
Okay. All right. Well, thank you all once again for your participation in today's webinar and for your feedback. We already covered the next steps and mentioned that while the needs assessment update is due in October, the Ohio Department of Health does plan to post it and distribute it. So again, thank you for your participation. We hope that you are all staying healthy and that you have a wonderful afternoon.